I think it's a great conversation because I feel like when we use the word regenerative, we're probably overselling something. And I think people hear that and they say, oh, we're actually going to regenerate cells. Well, maybe at best.
Yeah,
Think
maybe.
way I like to explain it is we're using our own body's cells, tissues, blood products, fat products, bone marrow, what have you, mesenchymal stem cells from our own bodies, and we're injecting the and we're concentrating them and re-injecting them into places that might need a better, healthier environment. When we take that platelet-rich plasma, PRP, and we spin it down and take what we need, re-inject it into a knee, that knee environment for osteoarthritis was probably pretty darn inflammatory. Calming down the bad inflammation and increasing the good inflammation actually helps things be a healthier environment. So that's the best way I describe it to patients. Now, is there a small degree of regeneration? There can be in certain tissues, but that's not really the selling point I tell patients anymore. I say, we're going to get your pain controlled and increase your function. And if we look at it like that, then we kind of take the word regenerative out and use that newer term of orthobiologics. Ortho coming from musculoskeletal and biologics meaning cellular tissues.
Welcome to My MD Unscripted, where healthcare gets personal and the script gets tossed. I'm Dr. Clint Carter, ER doctor turned direct primary care freedom fighter, on a mission to challenge how our healthcare system treats patients in America. In every episode, my expert guests and I dive into real conversations about what's broken and how we can fix it by making healthcare about people, not just managing disease. It's time to rethink what healthcare should be and how we can make it better together. Welcome to the podcast.
Hey guys, welcome back to the My MD Unscripted podcast. I'm your host, Dr. Clint Carter, and today it is my privilege to be joined by Dr. Nikhil Verma. Dr. Nikhil, thanks for being here, man. This is going to be fun. There's a lot of talk about regenerative medicine. I can't wait to pick your brain. So I'm going to do a quick little introduction so that everybody know what's going on, and then I'm going to ask you a question and get this thing rolling. So Dr. Nikhil is a board certified physical medicine and rehab physician. So he's a pain doctor by training and the founder of Essential Sports and Spine Solutions in Columbus, Ohio. He specializes in non-surgical solutions for spine and joint pains using interventional and regenerative medicine. We're going to hear a little bit about that today. He's also the host of a podcast called Things I Didn't Learn in Med School, which is a great title because there's an infinite number of topics we weren't taught, where he explores the mindset and leadership and physicians and all the things we need beyond training. So Dr. Nikhil, thanks for being here, man. And I guess my question to get us started is, after, 150 years of modern medicine, why is cortisone shots and surgery always seem to be the answer whenever someone has joint pain or something else going on? Have we not evolved past that yet? So introduce
No.
yourself properly, my friend. Thanks for being here.
Yeah, no, thanks again for having me on your podcast and the show. It's a great show. I've listened to a few episodes and looking forward to listening to some more along the way. To
Thanks.
answer your question, I think in the realm of trying to do what's best for the patient, doing things like cortisone injections or surgery seems like the next best step because that's what the insurance model wants. That's what the
Yeah.
studies that we have are based off of. Now, if we go back and look at, hey, what's actually the indication for corticosteroid injection for knee arthritis? I feel like they just did it for pain control as the only measure, and they forgot to measure life quality and all these other things down the road. And I
Yeah.
think they do that with a lot of things. They're just finding one measure that it kind of hits the tick mark on, and they forget about all the other things that could go into play. And even in the interventional pain world, I have a lot of colleagues that are doing these great advanced procedures. For me, it looks a lot like, what are we actually doing? Are we actually solving a problem, or are we just
Right.
taking away pain and destroying other things just to kick the can down the road? And that's what we're actually seeing. We're seeing a lot of patients, especially when we do radio frequency ablations of the spine, that their spine gets worse and worse quicker. And then down the road, now do they not only get the surgery, they get at a much later state where they might already have signs of cardiovascular disease,
Yeah.
dementia,
No. Right.
et cetera, et cetera. So there's always pros and cons to all these things. And I don't want to be absolutist about any of it, but I think
Okay.
there have to be better ways of what we're doing. And for me and probably a lot of your listeners and yourself is we really got to look at the whole picture. And if we can help the patient in the whole picture, then maybe we don't need to do any of these procedures down the road.
Well, and I definitely I mean, to be honest, and it's not like a big conspiracy. These procedures, those cortisone shots and the, you know, neurotomies and the different things that they're doing, they're sold as delaying surgery, put off surgery longer, wait to get that knee replacement later. And there's some value to that if you're
Yeah.
getting quality of life along the way, but it doesn't take into account whether or not a steroid injection in the long run makes your knee worse faster or,
Right. Right.
like it really, I mean, it feels better for that, you know, I use it a lot on someone whose knees acting up right before a European vacation. Like, yeah, dude,
Yeah. I
go for
agree.
the steroid shot. You need it to work right now.
Yeah. Fully
We're making
support
that
that kind of
trade to
thing.
death.
Yeah, let's help you out. Let's get you out of your acute pain. Let's get you back to, your vacation or hey, we want to just get you over the hump for physical therapy and maybe right now is not the right time for regenerative medicine options. But yeah, we want to get you out now and I understand that, but we also have colleagues that say, "No, we need to never do steroid injections." I don't necessarily I'm like kind of, well, there's definitely time and a place, especially when patients are coming to us in this severe pain. But
Yeah.
yeah, we got to start exploring other options.
Well, and so let's talk other options. That's the fun stuff. So what is regenerative medicine at its base? So there's a lot of words out there and people hear stem cells or all the different things. At its base, what is regenerative medicine? And then what does that mean in real practice?
Yeah, I think it's a great conversation because I feel like when we use the word regenerative, we're probably overselling something. And I think people hear that and they say, oh, we're actually going to regenerate cells. Well, maybe at best.
Yeah,
Think
maybe.
way I like to explain it is we're using our own body's cells, tissues, blood products, fat products, bone marrow, what have you, mesenchymal stem cells from our own bodies, and we're injecting and we're concentrating them and re-injecting them into places that might need a better, healthier environment. When we take that platelet-rich plasma, PRP, and we spin it down and take what we need, re-inject it into a knee, that knee environment for osteoarthritis was probably pretty darn inflammatory. Calming down the bad inflammation and increasing the good inflammation actually helps things be a healthier environment. So that's the best way I describe it to patients. Now, is there a small degree of regeneration? There can be in certain tissues, but that's not really the selling point I tell patients anymore. I say, we're going to get your pain controlled and increase your function. And if we look at it like that, then we kind of take the word regenerative out and use that newer term of orthobiologics. Ortho coming from our musculoskeletal and biologics meaning cellular tissues.
Yeah. And I like the fact that most of these, options out there are really just helping the body heal itself, to some degree. Maybe at the very least, slow down the damage that we're doing. But a lot of the times, heal up a little bit. You're not going to regenerate a new knee, but let's heal it up a little bit so that it's a little less angry and it can handle a little more wear and tear that you would like to put on it because you're not quite done playing tennis, that
Yeah,
kind of stuff.
absolutely. Yeah, and when we jump into the field of like mesenchymal stem cells, autologous and mesenchymal stem cells, whether taken from your bone marrow or fat, we've in our practice have saved people from hip replacements and knee replacements.
Yeah.
I mean, it takes a lot. It's not just the injection that does the trick. It's a whole process of taking them through what's your metabolic state at, what is your stress level at, what is your sleep status at, are you going to continue to have gait patterns that going to damage that joint even more in the long run? The ligament structures. What are your supplements? What's your diet? So we take all this into account before we even consider a procedure because we don't want someone that's metabolically inactive and has a morbid obesity, diabetes, high cholesterol. They're not going to function well with that procedure, and they might make it worse. Honestly.
I mean, you're injecting into a space that's going to potentially get more inflamed just because you were there. So your return on that investment definitely needs to be in the patient's favor. But the use of these, I think, I like that it's up and coming. It's not ever on the insurance flow chart of next steps. And so it's hard. I think it's hard as a potential consumer of these products as I continue to treat my body poorly. I think it's kind of hard to know when to pull the trigger on it yourself. Like, Do I wait until my surgeon's trying to tell me it's about time to have surgery? Do I get it the first time my knee does that little clicky thing? Because there's maybe points that are too late, but how do you know what to do? How do you take care of your folks and walk them through that decision-making process?
I mean, that's actually a fantastic question. And I'll admit to you, I don't know either what the best time is. We would imagine sometime early in the pathology would probably be the best time because if
Yeah.
we can calm it down early and recorrect those patterns and make that healthy environment, then maybe we're going to prevent any damage or any severe damage down the road. Now, most of the time, what ends up happening is we have patients that have tried everything,
Yeah.
including neurotomies, physical therapy, chiropractic, NSAIDs, Tylenol, maybe even some opioids, creams, et cetera. Maybe
Right.
they've already talked to a surgeon.
Some
That's
other
the time they
intervention.
come and they're just frustrated. So I would like to see patients a little bit earlier. And I'll give
Yeah.
myself as an example. Like I have a little bit of a radicular pain going down my right leg, and it doesn't bother me to do anything. I'll feel it about once or twice a year. Hey, maybe it's about time I go talk to a regenerative medicine specialist to be like, hey, what's the next steps? And I know what I would do. And I actually have a colleague that's going to do it for me. We're just kind of waiting until it gets a little bit worse.
Yeah, and because there are times that if you wait late enough, there's your body's ability to heal itself is going to be pretty limited. And that's
Yeah.
really what we're trying to get it to heal itself. What are some of your favorite orthobiologics? What are some of your favorite, methodologies in your practice?
Yeah, I think it's situational depending. I
Yeah.
think the financial burden for people and also the degrees of what they're dealing with. And we'll use arthritis because it's a little bit easier to talk about. When you're in that mild to moderate stage, PRP is just fine. I think it does a really good job and can really support it. Once you get to that moderate to severe, we really need to start looking at some mesenchymal stem cells, whether that be from bone marrow aspirate concentrate or micronized fat aspirate. I tend to use fat more in my practice for severe arthritis, partially because of what was indoctrinated in me that the fat cells have more stem cells
Yeah.
than the mesenchymal stem cells from bone marrow, but they
Yeah.
both have a lot of other factors in there that can help. So I kind of use the bone marrow aspirate for younger people. Once you get over the age of 60, 65, I kind of gear more towards the fat. Other things that we use in our practice, prolotherapy for especially like ligaments, especially upper cervical ligaments, maybe a facet joint, sacroiliac joint. We also have a MLS laser, a multi-lock wave system laser that can help with pain and inflammation. And other things my colleagues use are pulse uh, magnetic waves and shockwave. Those are two other regenerative therapies that are really popular right now.
That's awesome. I think, yeah, I wondered if you were going to bring up, any lasers or magnetic therapies because we have access to some of those here at our practice as
Yeah, those
well.
are great. They're great low level
Yeah, right. And then
and they work
PRP,
adjunctive.
PRP, unfortunately, is only as good as the host.
Yeah,
Which I guess, so, but we still use PRP well into, it's still maybe the best option that I can offer even to a 75-year-old. But
yeah.
when you do stem cells, you're always doing the patient's own stem cells?
Correct. That's
Okay.
partially mainly because of the legality, what the FDA
Yeah.
allows us now. You'll have a lot of reps coming out saying, "Oh, well, did we have a 361 HCTP certification?" Well, you might have that, and that's fine, but the FDA says you cannot use those for orthobiologic procedures. So you can say what you want, but that's what the FDA
Right.
says. And I've
Yeah.
asked my state board the same question. They said, no, you can't use these for orthobiologics, musculoskeletal conditions. So I have no
Yeah.
problem with people using them if that's what they want to do.
Right.
I just don't want to press my license at this point.
Well, it unfortunately, in that case, no one's got your back, right?
Yes.
Right. I mean, it's probably the argument can be made that some of those stem cells are even better than a
Yeah.
70-year-old patient's own what's left of their stem cells. However, right, until the government decides to get our back on that, yeah, your hands are a little bit tied. Let's talk about what you didn't learn in med school. That's super fun for me.
Yeah.
What inspired you to start a podcast called What I Didn't Learn in Med School?
I was, sitting in my office one day, like going through the frustrations. I started my practice training at fellowship, and I was always in tune to like how the practice was running and asking like higher level questions outside of medicine to my attendings, my fellowship directors. So when I started my own practice right at fellowship, I was kind of getting a lot of questions, and I had a lot of questions. So I started documenting my journey of this is what this
Nice.
does, this is what this does, insurance panels, how a physician gets paid. And as I continued to go on, I was just kind of like, what are the questions that my friends and my family are asking me right now? What are
Yeah.
the med students and residents asking me? And then it just kind of kept evolving into healthcare policy. And now I talk a lot about regenerative medicine and orthobiologics as well. But
Yeah, sure.
it's a combination of whatever is frustrating me because of what we see, the inefficiencies of the system, as you know, and as you talk about a lot in your podcast. Is
Yeah.
just trying to get that information out there because people don't realize where we're at in the landscape of healthcare.
It's a spiraling. It's just every year it's worse than it was the year before. I don't know when it's going to sort of like hit the bottom of that spiraling deaths, path that it's on. But,
Yeah,
paying more for insurance every year and getting less for it, it can't last forever.
correct.
And, it's not that like, so I practice direct primary care, which means membership based medicine. And that's not the only answer to the problem, but folks like you doing cash based procedures that are better for the patients than the insurance would provide is amazing. But it has put a burden on you to go out on your own and figure it out and take those chances and take those risks and teach yourself above and beyond what you were taught in residency and fellowship, right?
Yeah, yeah. Absolutely, and I think that I mean, that's part of the fun of it all. I don't know what else I'd be doing with my time.
Yeah.
I know I couldn't be just a needle jockey for an orthopedic center. I don't wanna work for a hospital right now either because
Again,
it's similar concept, so, yeah, it's fun to learn, and you learn at something every week, every day, and you keep learning, you go to conferences, but also, you find ways to make, ends meet. We'll say, I still do locums to help make, extra money to
yeah,
make sure that I'm not suffering and, why am I doing this, pulling my hair out? Because it was like that for the first few years where it was like,
it
"Well,
was.
when your next paycheck?" So, you have all these steps, but yeah, it's fun and hence, like, why I started that, the YouTube channel was, "Hey, you're not the only one going through this journey. We're all going through it, and I think it's important to have the independent doctors working together and helping each other out."
Well, I love it. I mean, amongst the other things that you're having to teach yourself that they did not teach us is leadership. How to lead a team, how to, God forbid, you have employees, when I burned out in ER, I was a family medicine residency, looked at those clinic jobs and was like, no, thank you. Kind of
Yeah,
like you did. And then went to the ER because, it's fun. You're off on a random Tuesday, whatever. I don't have to manage a team. But then I lost my identity. At some point, I'm just like in the machine, just half-ass getting people out of the ER who weren't having emergencies anyway. And just, it's like, there's just what my purpose, my why, I asked my wife at one point, is it a job if it steals your soul every shift? Like, is that really, because we're getting well paid, but
yeah,
I just can't anymore. And it's not that I have anything against any of my colleagues that are in the machine, making it work, taking really good care of people with limited time and resources inside and outside of the ER. But, just all these things that when they train us, they're not they're not saying, "Hey, you might want to go start your own clinic. Here's some entrepreneurship. Hey, here's how you properly communicate to lead your team." None of those pieces because number one, we have a limited amount of time. And number two, the assumption is you're gonna work for the man and you're only gonna do things that insurance pays for. So why would we waste our time?
right.
Right?
Exactly right.
Oh, yeah.
It's
But
tough.
man, I love what you're doing. I love the name of the YouTube channel. That's I'm totally tuning into that. That's gonna be great.
Yeah. Yeah, it's just kind of who I am, a little tongue in cheek when I talk about things like this too, and, might have got me in not necessarily trouble in the past, but I know doctors have not liked it,
Yeah.
but it's also I kinda see it when you're again, like you, I have no problem with any of my colleagues that are in the system, in the but when you're indoctrinated into that system and you don't see anything else and
Yeah.
you can't even realize the poison you're drinking, I
Yeah.
think that's a big problem, and I think a lot of more of our colleagues are starting to wake up to that, as you said, over the past few years.
It's really fun. Like I went to a doctor for my own medical problem. This guy, like I had never even actually met him. He's a generation older than me. And I walk in, or he walks into the room after I've been waiting for a while because that's how that game's played. And and he's like, "Oh man, yeah. Hey, how's it going?" Like, um, uh, what was his exact words? He was like, uh, is it as good as it sounds like it is? And I'm like, are you talking about my neurologic thing? Are you, you know, like he skipped right to, hey, you're doing direct primary care. Is it as awesome as it sounds?
Yeah.
And I was like, yeah, I mean, the medical part for sure. Running a practice is challenging and fun and all those things. And I've learned God sort of put the right people in my path to learn about being a leader and how to run a practice. Like you, when we started, I just had 2 jobs and I just did this one and the other full-time job, and then watched the bank account and prayed that it had enough in it to cover payroll.
Yeah.
And then eventually started to learn how to run a business a little
Yeah.
bit, which has been a really a blessing.
Yeah. I think that's the thing. I think a lot of people are afraid to start. I get it. You're used to that paycheck. You're used to that. But I think there's
Yes.
always somewhere to start. You can start small, 1 day a week or half day a week. And then, like you said, you work 2 jobs for a few years or a few months or however
Yeah.
long it takes. And you build your business skills up, you build your practice up. And the next thing you know, you leave that other system behind and you can do great things.
Freedom in choices, man.
Yeah.
You don't have to leave the other job if you're loving it, but you have the freedom to do so
Yeah. I actually have a
when you know
colleague.
better.
He transferred out of clinical medicine. He worked at a hospital. He was actually the chief medical officer,
Wow.
C-suite, and then he's just like, this just isn't me. So he went back to working for the system only 3 days a week. He does physician coaching 1 day a
Yeah.
week, and then he
Yeah.
does a free clinic half day a week. And he's
Yeah.
like, the biggest joy I do is go doing that free clinic half day a week and
Yeah.
helping the physicians out. But I know my obligation to my patients if I can't just walk away from the 3 days a week at the hospital system. So I
Yeah.
said, no, that's great that you have a good balance now. He's like, I'm 10 times happier than you can ever imagine. So,
Yep. You know, most of us got into medicine because we really do enjoy the process of problem solving in a way that helps other people. Yeah, some
yeah,
combination of that, right? We like to know the answer. We like helping people. One thing that I burned out in the ER is it was everybody's worst day, and then there was no sort of like patient doctor relationship, certainly not a ton of gratitude. You know, they were either, if you did something
yeah,
great, they were probably intubated by the time that you got done with them. But
yeah,
this, that first year that I had a clinic, Christmas came around and the gifts and cards started flowing in. And I was like, wait, people send their doctor Christmas cards and stuff and like food, like in the ER, if someone brought food, you didn't eat it. They were probably trying to poison you because you didn't give them
right,
the Coca-Cola they wanted last week or something.
right.
But, you know, what I like about so much about kind of your whole setup, man, is you kind of saw the light coming right out of residency fellowship. You were willing to put in the work, and then you started documenting all the lessons along the way. And then along the way comes all the regenerative medicine stuff that is literally changing, should be more than it is, but will eventually completely change orthopedics, pain medicine, all of our sort of, you know, that muscles and bones side of things, and then beyond, way, way beyond just
Yeah, yeah,
orthopedic painful things. But
I
really
agree.
looking forward to what the next, I don't know, man, things move so fast. We think decade.
Yeah, probably the next 10 years. What we don't have the ability to do here in the US quite yet is to take our autologous stem cells, bone marrow,
Yeah.
or fat, and expand them.
Yeah.
But I think that'll happen in the US in the next 10 years. I'm very bullish on the idea of peptides. We're gonna see how they work in
Yeah.
combination with things.
Yeah.
I think hormone replacement as well. I think a lot of times as we get older, because our testosterone and in women as estrogen goes down, I think we're starting to realize how that affects musculoskeletal health. So we're gonna start getting really scientific on all of
Yeah.
this, and we're gonna have someone that's really well versed in the hormone peptide world. Hey, we're gonna add on your orthobiologics from this provider who's been
Yeah.
trained to do visual guidance and all the good stuff, and we're gonna really make a difference in people's overall health status.
I'm really excited about it. And so, cause like where I'm, you and I make a nice combo because we do all of the, obviously the hormone, peptide, weight loss, that's just wellness, longevity, walk with our patients, hour-long visits, 24/7 access, really we're just a part of them living their best life for the next however many decades. But
Yeah.
along the way, this ability to heal their body as we wear it down, doing the fun things and the accidents and those things. Yeah, that's going to be a nice combination. Plus, whatever else, stem cells and
Yeah.
to what extent is that going to be the answer to liver failure or
Heart failure. There's really good data on lungs right now. Yeah. So yeah, definitely the heart and lungs are the ones that the studies in Japan are going on right now that are probably going to make a big difference. And we know the liver's ability to regenerate already. It just seems like a
yeah,
natural
same.
carryover.
Yeah.
So yeah, you're 100% right on all that.
Well, man, so let's say I'm listening to this podcast. My orthopedic or my spine guy is saying that I'm headed fast for surgery, but still got pretty good function and a decent amount of pain. What's the next best step? What should they do? What should they look for?
Yeah. So obviously, I think there are physicians like you that can provide that PRP in office for generic stuff. And I would never take a patient away from that. But there's always going to be a level up, right? So
Yeah.
a lot of times patients will be like, "Oh, my doctor did PRP or stem cells." Well, my doctor works in an orthopedic center, and their orthopedics make the most of money by doing orthopedic surgeries.
Yes,
Well,
right.
I make most of my money, not that it's all about money, but my revenue and the thing that I spend every day reading about and talking to colleagues about is regenerative medicine. So
Yeah.
I would really implore people to look into a regenerative medicine specialist, not
Yep.
just an orthopedic doctor or a sports medicine doctor that does regenerative medicine on the side, because that's what I see that the most failures of regenerative medicine. Then it gives the whole field a bad name.
Yeah. Yeah.
You have a chiropractor who hires an NP 1 day a week to do PRP in the spine, and they're just barely getting the paraspinal muscles.
Yeah.
And
They're
we don't.
not even close. Yeah.
So it's
Yeah.
like, that's a big difference in my book. So I would really implore them to look for regenerative medicine specialists. The AI and Google search for regenerative medicine specialists in my area. They've become very good at identifying that because we're the people that are putting out blog posts, talking about it every day
Yeah.
on our platforms. And
Yeah.
then outside of that, I think just getting that second opinion, it might be worth it. It's definitely not for everybody. Just last week, I had to turn someone away. I told her, I don't think I can help you. I really do think you need surgery.
Yes.
That's the honest truth. And she still was willing to pay me. I said, I can't in good conscience do this because I don't think you're going to get the benefit of 50 to 70% that I'm looking for in my patients.
Yeah. It's not free. What these things are doing, it's
Yeah,
not covered by insurance and it's not free, but there is vast amounts of value to be had in the right patient getting the right regenerative procedure at the right time, right?
exactly right.
But it can just be money spent by someone who was maybe a little less upfront than you were with her, going, "Yeah, stem cells may help. Let's give it a shot."
Yeah. Yep. Yeah.
Um, do you do any work outside of the Columbus, Ohio area? Do you have any virtual reach or any
I don't have any virtual reach. I'm always happy to do a consult or take a look at someone's case.
yeah,
And typically what I do in that situation is I try to refer to them someone in their area
yeah,
or someone that might be advanced in that certain thing. There are surgeons out there that will combine their rotator cuff repair with pure stem cells.
yeah,
And they're doing a good job. Or there's someone that might do this certain specific procedure, upper cervical instability, in their region. I'll refer them. But if they're, adamant about working with me, I'm happy to take a look over online, read their case. And if there's someone I want to work with, then we can set up a consult and get them in my office and go from
yeah,
there.
yeah, man. I mean, there's flights in and out of Ohio every day, so
Yeah. Thankfully my office
absolutely,
is only 10 minutes from the airport too.
you gotta
Makes it easy.
you set up your next office in the airport. Don't even have to leave.
That's the future. Can help a lot more people, I think.
Well, Nikhil, man, thanks for coming on. How can people reach you if they do want to maybe get your opinion and expertise?
Yeah, that's a great question. So my website is essentialsportsspine.com. You can find me on pretty much all social media platforms, Substack, Nikhil Verma MD. My Substack's called Essentials of Healing. As we know, my YouTube channel, Things I Didn't Learn in Med School. You can find me on Instagram, Dr. Envy Sports Spine, and that's also my X handle. And then there's also my practice handle on Instagram is Essential Sports Spine. So
Dude, you got me beat in like 17 different ways. That was awesome. But we'll get all that in the show notes so they can
sure.
just click on the one that works for them and they can reach out. But dude, I mean, I love everything about what you're doing. I think it was very forward thinking of you to make that leap right out of residency. And I know that maybe that sounds like for a lot of the listeners, like, well, of course you did that right out of residency. Like, no, in residency, and fellowship, they assume that you're going to go work for the man for a while and then maybe burn out and then maybe take that chance. So it's actually quite forward thinking to do that right out of the gate and brave. And I commend you for it. And it's really fun what you're doing. The YouTube and all of the social stuff makes it even more fun. So
Yeah.
thanks
Well, I
for
appreciate
coming.
that. It means a lot coming from someone that's been doing it his way for a while. So it means a lot.
Well, thanks, man. But I had to learn the hard way. Finally, I hit my head against the wall enough times it started to hurt. So, but thanks for coming on, and I look forward to hearing from you in the future as things grow. And you need to get us updated. But in the meantime, I can't wait to follow you on YouTube and figure out what else I didn't learn in med school.
Cool, man. Take care. Thanks so much, everyone.
Take care.
Thanks for joining me today on MyMD Unscripted. I hope today's conversation opened your mind and inspired you to imagine a better path for your health and therefore life. If you found value in this episode, be sure to subscribe, leave a review, and share it with someone passionate about transforming healthcare. Real change starts with real conversations, so let's keep them going. Until next time, stay well, stay curious, and never stop pushing for better.